Here's today's Genesis Medical Moments.
We are continuing our conversation about prostate cancer today. Dr. Bream, you touched on who is most likely to develop prostate cancer. Talk to us now about just how curable this disease is.
Sure. Fortunately, prostate cancer is a type of cancer that tends to be slow growing, and we tend to have very high cure rates for the cancer. A lot of times it is stage dependent. If men are presenting at an earlier stage, they're getting picked up by screening, we're finding those cancers very early, and so our treatments, whether they're surgery or radiation or some combination of the two, can be very successful, and men can put this cancer behind them and focus on recovery.
Okay, yeah, so what men can do to ensure that prostate cancer is detected early would be some of those screenings you just talked about, right?
Yep, it's going to see your doctor. Men are men. We don't like going to the doctor.
Right.
But this is important. It's just simply a blood test and an exam with your doctor.
That easy then. So kind of in and out, really?
Yep.
Okay. After cancer, what other prostate issues should men be aware of?
Sure. So prostate cancer is very common. What's even more common than that are men with enlarged prostates. As we get older, our prostates grow, and that oftentimes causes urinary problems. We're getting up at night to pee, or the stream is not as strong as it used to be, and there are good treatments for that, whether they're medications, minor procedures, surgical procedures in the office, or some men just grow a very large prostate, and surgery is really their best option.
Okay, and you have a demonstration that you're going to show us.
I do,
with
yes.
With an orange.
I do. So the prostate is kind of like an orange. It's usually not as large as an orange. When men have prostate cancer and we do surgery, we just need to remove the entire orange, the outer part and the center pulp. But if some men just have a very large prostate and all the obstructive urinary symptoms that come with that, the best thing to do is to just remove that center obstructing tissue, which is just like the pulp of an orange. And there's an old school operation that had been done for decades, bigger open incision, and you basically just scoop that center part out with your finger.
Okay.
Nowadays we do that robotically, and that's been a big game changer. You can see into the deep dark pelvis, you can see the bleeding blood vessels, and once that part is scooped out of the center of the prostate, you can actually sew the bladder back up to the urethra, and these men heal very quickly. They tend to stay in the hospital one night. We do that operation well into men's 80s if they need to, and so it is something that we can offer to older and older men should they need to, because the recovery is so quick.
Yeah, that's really quick, and we've come a long way.
And it makes a big
robots.
difference when you remove that much tissue. These men pee. They pee great. I've had patients come back and say, I haven't peed that great since I was 35 years old.
That's awesome.
And that's why I like doing what I do.
That's awesome. That's awesome. Dr. Bream, thanks so much for your insight today.
Thank you very much.
No
Happy
problem.
to share this knowledge. I think it's very important for men, to get screened for prostate cancer, but then also not to ignore their urinary symptoms, and ask a doctor when you have questions.
All right, some good advice. This was your Genesis Medical Moments, and for more information, you can go to ourquadcities.com and click on the Medical tab.